Please join me in welcoming Karina Wiggins.
Hi, everyone. Good morning. I'm a little short, so I'm going to bring this a little closer to me. Sorry about that. Actually, I might just grab this off. It's good to be with you. I also, when I say good morning, I also say bom dia. Any Brazilians in the house? Hey, Brazil! I am Brazilian American, so when I come and speak in community, I always believe that I bring not only myself, but my family, our culture, our community to the space. So hoping that y'all can welcome that as well. I work for Within Reach. I'm the Help Me Grow Washington program director. I use she, her pronouns. Really happy to be with you all today and share with you a little bit about our work that we do with families all across the state of Washington. I'm going to be focusing on two main food benefits and how those infuse into the Help Me Grow Washington model. So we're going to be talking about women, infants, and children, the WIC program, as well as SNAP, Supplemental Nutrition Assistance Program, and how we support families in getting access and connection to those. We'll do a quick overview of what Help Me Grow Washington is. If you want more content or information, we do have flyers that are on the resource table in the back. We'll be talking about service offerings, as well as how you and those that you are connected with can learn more about Help Me Grow and contact us if needed. So a little bit about Help Me Grow. I heard some folks in the prior presentation say, there was that visual of the babies being in the river and going upstream. That's an interest or maybe a common story that you all hear. I turned to my colleague Lark over here and said, Help Me Grow does both. We work at both the systems level in helping improve what it looks like for families to get access to resources more quickly. We do that in partnership with families, community, providers all across the state. And we offer a direct service through our Help Me Grow Washington hotline and a few other avenues that I'll connect on today. There are no income or eligibility requirements to contact us. When you see the phone number on the screen, I encourage you to put it in your contacts list. You never know who you might connect with that could benefit from accessing Help Me Grow. We take a whole family approach. So we're not just focused on the individual that we're connected with. We are asking questions about who in the family also might need resources. We take a multi-generational approach as well, recognizing that families come in all different shapes and sizes, and we want to make sure that we're serving everyone in the household, not just the caller themselves. We also work really closely with providers. And provider, I kind of use that as a loose term. That could be a medical provider, a case manager, a community partner. And we want to make sure that we have easy access for providers to make referrals directly to us through our online platform, as well as receive a report back to you if the client and family consents. You can actually see what they accessed when they contacted us. So we really want to make sure that we maximize on that wraparound approach, recognizing that I think within the U.S. tends to be a fairly individualistic society. We take a community approach to make sure that we're wrapping around the family with not only what we're offering directly, but with all the resources that you might have as well, and ensure that the family is connected effectively. We also have a resource finder. So if you go to helpmegrowwashington.org, there's a little orange box that says Find Resources. We have over 6,000 resources available throughout the state of Washington that folks can access. I would encourage folks to search in there a resource that you or someone you know might need and see what might come up. It's filtered by language as well. We have culturally supportive services that are infused into that resource finder as well. While we take a prenatal to 5 focus on a family, so many of our resources, our structures, our focused areas are going to benefit families that are in that prenatal stage all the way up to age 5, we do not deny service to anyone. So we do at times get calls from seniors or folks that are outside of our age range. We will continue to assist them until we can get them connected to the next best service. These are our 4 service areas. So we're working on improving food security. That's here while we're here and in partnership with all of you all today. Access to adult and pediatric care, so helping with health insurance applications as well as getting folks connected to their nearest clinics. Family stability supports, so that could be diapers, that could be meals that are available nearby, that could be clothing. And access to early childhood development supports. So we have a link on our website where families can access the Ages and Stages questionnaire. That is a milestone tracker. So we want to celebrate things that are going well in a child's development and also make that available for families if they have concern about any kind of delay that or support their child might need. So when someone contacts us, we facilitate an intake and screening that covers all those 4 domains. You can see some of our common resources here on the screen that folks ask for. And the number 1 resource in 2025 that folks called us about was food. So that says something, right, about the reality that, if you're thinking about the Maslow's hierarchy of needs, food, being hungry, needing something in your belly. We all needed a break, right? We all needed a little snack before we could pay attention more. That comes up as our number 1. But even if somebody's calling us about food or how they might be able to access food in their community, we are screening them for all kinds of other resources. There's like 39 different resources, domains that we're able to connect them with and see what they're eligible for based on their responses. I encourage you all, give us a call, get connected with me afterwards if you want to see a call and what that might look like. Be happy to support you in that as well. We also have more independent ways for folks to get connected to our resources, and I'll go over that as well. So number 1, I've talked to you about the Help Me Grow Washington hotline. That's the number that I encourage folks to put in their phone. We are available during business hours, Monday through Friday, 8 to 5. So I recognize those times are not always the most convenient, right, for folks on the weekends, but hopefully, to the extent possible, folks can give us a call during the day, and we can do that screening with them. We really take the phone calls based on what the family's needs are and what their time constraints are. So some hotlines will require you to only, cover a certain amount of things over the call. We have navigators that will stay with the family on the line for up to 2 hours or more, depending on what they want to accomplish that day. Also, we get calls from folks with little babies, little ones, and so sometimes they are not able to take that full amount of time. It just kind of depends on what they're interested in. So if they're interested in doing a SNAP application and health insurance, we kind of see how much time they have available and can break that up into a number of different calls, or get them connected to their WIC clinic fast, and that might be a really short call. We also have a screening and online form. So while you're on the website, you can explore. There is a prompt where you can actually screen yourself, what we consider a self-referral. Enter in income information and eligibility to see what resources you might be eligible for. There's also a provider referral prompt as well under providers on the website where you can submit a referral for a family that you're working with. And that was kind of that example I gave earlier where you can get a report back based on what the responses were and what resources the family got connected to. And then you can searching our online Parent Help 123 resource directory. So specific to WIC, I'm going to transition us a little bit for this program. Many of you may be familiar already. the nutrition program for women, infants, and children that is operated through the Department of Health. We've had a long-standing relationship with them for many, many years, and you'll see some of our information posted on the DOH website. When families contact us and they're in that prenatal to 5 period, we ask them whether they're interested in getting connected to their nearest WIC clinic. WIC can offer a variety of services, and folks don't always know what might be available to them. So our navigators over the phone are coaching the family based on what might be most priority. And sometimes it's just a number to their nearest WIC clinic. Others might have more hesitancy in understanding what that service brings. So we talk about the eligibility depends on household size and income. There's one piece folks tend to forget, probably based on the name of WIC itself, that dads, grandparents, and other caregivers for children under the age of 5 can also receive WIC benefits. Foster children under the age of 5, as well as teens who are pregnant, are eligible. And if you or a family member are already enrolled in SNAP, Medicaid, or the TANF benefit, you could also be eligible as well. Many military families are also eligible. So we always encourage folks to contact them, and we kind of go through some of these misnomers with the family over the phone if they're concerned or hesitant about accessing this resource. What does WIC provide? Nutrition ideas and tips. There's an in-person component to WIC where families are able to meet directly with a nutrition support staff who also provides breastfeeding and chest feeding information by a peer counselor. There's also monthly kind of electronic WIC benefits for healthy food and fruit. There's a lot of different education material that is provided for folks enrolled in WIC. I always encourage go on the Washington State Department of Health website to learn more. But these are just kind of some core areas that sometimes folks forget about. I think they think WIC and cash assistance. Yes, it is cash assistance, but there are also these other supports that's helping the family as they are navigating those early years. So here are some other ways you can find a WIC clinic. Of course, you can go to our Parent Help 123 website. I encourage folks to do this if you're able to text the acronym WIC to 96859. It's going to prompt you for your zip code, and then it should give you a list of WIC clinics nearby you. So that's another resource for families as well. And of course, contacting our hotline if you need any additional assistance. Here's my contact information. We're going to do part 2 next because the plan was a little different before, but we're pivoting. We're agile. That's important in this work, right? All right. So talking about SNAP, we provide information about the Supplemental Nutrition Assistance Program through our hotline. And we are able to offer application assistance. This week, I was shadowing one of our resource navigators, and it's not the easiest thing to go through a SNAP application. I wish it was, but it's not. So it's helpful to have a resource navigator who knows the ins and outs of what might be supportive to you in that process and can help you determine what next steps are. So we'll do the application for them through Washington Connection, and then the next step to that is getting them connected to their nearest Department of Social and Health Services office, and they can either do an interview over the phone or go directly in person for that as well. Our team is immensely skilled in understanding some of the eligibility requirements for SNAP, but we also are really clear with folks that we are not DSHS. So there may be policy changes that impact how somebody's application is processed, whether they're able-bodied or not, whether they qualify for certain exemptions. So those are discussions that we have with the family over the phone to just give them a heads up that the interview process is to determine what they will receive from their SNAP benefit. Within Reach, we are also what we call internally a master contractor for Western Washington. We work with 24 subcontractors that support families in getting access to basic food. SNAP kind of has a variety of different names, right? SNAP, basic food, food stamps historically. And these subcontractors, along with Within Reach at Help Me Grow, are able to connect with families, debunk some stigma, and help them understand what they might be eligible for. Our goal overall is to increase participation. We know that many families don't apply for SNAP because they may think they're not eligible. They may think their immigration status could influence them, but really when an application is being processed, it's the whole picture of what the family might be going through. There are different eligibility pieces that may exist depending if the family has children or not. So we always encourage folks to have their application processed. We also, in the midst of that, get them connected to their nearest food banks, to other health clinics that may provide food security support, as well as senior citizen centers and one-on-one education. For basic food outreach in particular, eligibility depends on your income level, not your resources. Age does not matter, whether you have a home or experiencing homelessness, working or unemployed. All of these pieces are captured within the application, but we always encourage folks that they may qualify. So please enroll if possible. And then usually those applications are processed within a week, and generally our clients get connected to DSHS as soon as they're able, right after they're able to process the application with us over the phone. Monthly benefits, as we'll see here in the next slide, vary depending on the size of the household and what their income is. So you can see kind of how that looks. We recognize that, of course, SNAP is supplemental to other resources that they may have available to them. But this is the current breakdown as it relates to income limits and then monthly benefit amounts that a family might receive depending on their household size. And the last piece I wanted to touch on here, within Reach and Help Me Grow, we host a forum quarterly that's called the Basic Food Education Forum. If you click that QR code, you'll get connected to an opportunity to learn more or register for what's called BFEF. And this meeting convenes all of those 24 subcontractors that I mentioned earlier, as well as other folks in community who are passionate about food justice. We take this as an opportunity to regularly be informed about changes related to SNAP or other food resources in community, and approach this topic on throughout the year with the whole state invited. So we invite you, if you're interested in learning more and staying connected, feel free to capture that QR code. And thank you for the work that you do.
So we have just a couple of minutes. Anybody have any burning question for Karina? Just wanted to give you a chance to do that before she talks. Okay, can we get a microphone back in that corner?
Hey folks, Walter Topete, nice to meet y'all. Yeah, Karina, thanks for the information. I was just curious, do you know if there's a social security number requirement for those programs, or is there availability of access if you don't have a social security number?
Good question. For WIC, there is not. For SNAP, I am not entirely sure. I think they may ask for an ITIN number if somebody does not have social security, but I'm not positive, so maybe somebody else does have that answer.
I just had a quick question. I'm kind of familiar with the Help Me Grow system and the resource data. I was just wondering if you guys have made significant strides in how you support the rural areas, because I know resource data for the rural neighborhoods and rural counties, families were being sent, like Whidbey Island, for example, families were being sent to Everett for food. And so the system, data, AI, the system did not know the local resources that were available or had that wraparound system in there. So I just wanted to know, how has that been? Has you guys been able to figure out the rural data and how to get families that are reaching out from the rural areas to the partners and community support that's close to them?
Yeah, really great question. Thank you. I don't know at what point in time you connected with Help Me Grow. I've been at Within Reach and Help Me Grow for 4 years. So in the last 4 years, we have been doing more connection directly with communities and tribes to see what resources are missing from our database. And as we build those relationships, if you want to, you can always follow up with my colleague Lark over there. She is actually our systems and partnerships and linkages team member. Her and her team were hired specifically because of that. There's probably other reasons, but one of the reasons is because of exactly what you're talking about, how rural communities, their information and resources were not reflected. We also have a data system evaluation team that works to make sure that community information is inputted and that all of those 6,000 plus resources are contacted at least once a year to see if they're still relevant and still active. And so to answer your question, we're a work in progress, not perfect. We always encourage folks, if there are resources in the database that are not there, that are missing, to let us know. There's actually a prompt in the database where you can insert that information or tell us these things are missing, but we are also proactively building relationships across the state with folks to make sure that our database is relevant. And folks can actually upload, send us because oftentimes, as folks may know, in more rural communities, there may be a variety of different tools that are used that may be in a binder or a pamphlet that a staff regularly references. We want those materials so that we can include them in the database, and we have had community partners actually give us those materials to upload. So progress, not perfection, is my mantra. But if there are things missing, we want feedback. We want those relationships. We know that any of the work that we do is not possible without relationship. There's so much technology, AI, other things that are going on, but we can actually not serve families effectively without each of you. So please contact us. Please reach out afterwards. We are an ever-expanding network.
Hi, I'm Kat C. I'm with Twin Sisters Mobile Market up in Whatcom County. We're excited to hopefully start taking the WIC program for the first time and as the first mobile market in Washington State to accept WIC. Thanks. That's still hinging on rulemaking, but we hope to hear back soon. And I'm just curious, we also primarily serve rural Whatcom County. And we were told that for farmers markets through the FMNP program that we actually can't sell eggs or dairy through WIC. Is that correct?
I am not sure. I don't work for the Department of Health, so I'm not sure of what their regulations are. But I would encourage you to contact them directly. We do have contacts if you want to kind of know at the system level somebody to speak with about that. I'd be happy to connect with you. Is we have people that we regularly meet with who update us on the clinic information. So I have somebody in mind that I can pass your email to. That can hopefully help you navigate that.
Yeah, we've been hearing about some reductions in SNAP benefits. So I wonder if you could talk to us more about that, since it's only been hearing about it, but I just don't know a lot about it, of what those reductions are, who they're affecting, and if you see that as temporary and then they're going to be coming back, if that's something you could give us more information about.
Yeah, so as the prior speaker talked about during COVID, there were additional funds available for families in relation to not only SNAP and otherwise. And over time, the amounts that families have been able to access changes. Generally, they don't change their income and that other table that kind of references how many benefits folks can access that happens on an annual basis, but there are eligibility requirements that shift. So folks who are able-bodied have different requirements after a period of time related to employment, and that can be a friction, right? As we know that many folks who are able-bodied might have other barriers as to why they're not able to work, or if they're unable to pursue work. There are exemptions that DSHS is able to walk through with a family or individual that to see if they may qualify in these different ways. Previously, students had different qualifications or metrics that they were able to for their access to SNAP, though. That has changed as well. I know I'm not getting into the super specifics. I do that intentionally because I don't work specifically for DSHS, but I do encourage folks to talk to their local DSHS office and to, no matter what, to complete an application, even if you think you might not be eligible or families might not be eligible. But the annual tables that you saw up there generally change on a 12-month basis. And of course, I should also mention, there are implications at the federal level related to reductions in SNAP overall, which we are tracking closely as a state and community, and hope that we can retain SNAP benefits for families as long as possible. It's been a key program in the country since the 80s, and we talk about that frequently at Within Reach as well, that we're standing strong with our community to ensure that those maintain.